focus on what was happening in the most disadvantaged segment of the population, and a sense that the key aspects of the data were suggesting health inequalities are getting worse in Scotland because things seem to be so difficult in this population group. So this is an example of one of the charts from the University of Glasgow led underpinning report, and this is showing the spike in drugs deaths, where we see that is really different across the different population groups by deprivation, and we see this real spike amongst the most deprived group, and that particular issue is particularly centred on men. We also saw quite a concern coming out across the reports in terms of what was happening in early childhood. And so this map is taken from the Fraser-Valander report and is showing the huge inequalities that we have in Scotland when it comes to child poverty, despite that very strong policy focus on child poverty. So this is some of the background to explain why, when Health Foundation decided to invest in some work in Scotland to continue looking at health inequalities, they asked us to focus on families with young children in low-income households and men aged 18 to 44. So that was very much driven by those review findings. Then in setting up the unit, we've organised our work into kind of 4 key work strands. So and you'll be hearing about the first 3 today. So commentary and analysis, which Alison will be talking about. Strengthening policy implementation. So that's really to try and get to grips with that gap between policy intent and lived realities, which Fiona will be talking about SHERU's work there. And then enhancing the evidence base, which David will be talking about. And we're also doing lots of engagement at work. And of course, this webinar itself is part of that. And we're looking forward to your questions. But with that, just one more note, actually, before I pass to Alison, because we are aware this is a relatively busy space at the moment. There's a lot of different organisations working on health inequalities and trying to close that gap. And one of the newest initiatives is the collaboration on health equity in Scotland, which involves the Marmot team. So I just wanted to give a bit of a sense of how our work complements and differs from that work. So our starting point is the key policies shaping social determinants of health. So we've got a particular focus on employment, economy, housing and poverty, because we know that those impact the population and our key population groups that we're focusing on. And we are undertaking some locally focused work, which Fiona will talk about. But that is it's really kind of led by the policies and our population groups. So in contrast, the chair's collaboration with the Marmot team is taking an area-based approach, and their starting point is with the 3 local areas they're focusing on. And then they are looking at quite quantitative data, whereas our locally focused work is really about understanding a range of different perspectives. So as you'll see from Fiona's presentation, it's really quite qualitative in nature, that locally focused work. So they're very different approaches, but they do have similar goals, ambitions and timelines. So they're taking place over the next couple of years, and they are both working to try and reduce health inequalities. And so we're in regular touch with the Public Health Scotland and Marmot teams to think about what we can learn from taking these different approaches over a similar timeline. But with that, I will pass to Alison for the first 10 minutes of the presentation.
Right, thank you, Kat. So, like Kat said, my name is Allison Catalano. I'm working on the commentary and analysis strand of research here at SHERU. With commentary and analysis, we've got kind of 5 main streams of work. So we've got original research, which would be longer term research projects and publications that we release throughout the year. Our first release in this area hopefully will be due around the spring. We've got monitoring prevention, which we're doing through a regular publication called Prevention Watch, which looks at sharing and scrutinizing recent developments in the preventative healthcare space. Explaining new statistics, which we publish roughly monthly. My colleague David will talk more about this area in a little bit. Translating UK analysis to Scotland. So essentially, we're looking at UK-based reports and trying to replicate them for Scotland specifically to see kind of what might be interesting or different. and non-technical summaries of academic research. Since we are based at the university, we have access to academic publications that people in other fields may not. So we try to find publications which are relevant to health inequality in Scotland and summarize and disseminate them for you. Since our launch in September, we've had kind of 3 key publications. One which looks at changes in disability benefits in Scotland since the pandemic. Again, this replicates a publication that covers England and Wales. We also had our first Prevention Watch publication, which again, that's looking at developments in the health prevention space. And finally, a report on Scotland's census, where we compared socioeconomic variables for people living in deprived areas between 2011 and 2022. So I'm just going to give a quick overview of each one, and if you have any questions about what the reports entail, please feel free to pop them in the comments. If you're interested in learning more, of course, they're available on our website, along with our earlier publications. We had several leading up to our launch in September. The first report that I want to talk about looked at new disability benefit awards for adults in Scotland. This replicated some work done by the IFS and the Resolution Foundation, which looked at increases in disability payments in England and Wales since the pandemic. So for Scotland, we found that there was a big rise in new disability payment awards through 2023. Scotland saw higher rates of awards compared to England and Wales. And there's no real clear pattern in the data. There's nothing that we could really single out as a determining factor for why Scotland has seen more disability claims in the last couple of years. There also remains a lot of uncertainty about why disability benefits in Great Britain in general have risen so much post-pandemic. And there's a lot of qualitative work that could explain some of these drivers, some of which exists in other parts of the UK, but is severely limited here. Again, sort of the key kind of statistics to kind of give you a visualization of this. Compared to England and Wales, we saw a really large jump in disability benefit awards across 2023. To an extent, this was kind of predicted because of the changes in disability packages in Scotland. So, we rolled out the adult disability payment in 2022. And part of that process is that there were several things introduced to the application process that made it a bit easier to navigate, such as online and face-to-face options for applying, more ways of accessing pre-application advice, and a little bit more transparency surrounding application criteria. So there was a thought that these ADP, these adult disability payment awards, would remain permanently higher than the equivalent in England and Wales, the personal independent payments. Although kind of after that initial flurry, what we're noticing is that applications have calmed down a good bit. And again, one of the key findings from this was that there wasn't a clear trend in age or disorder. Certainly, we saw big increases in awards amongst young people. We saw a big increase in awards for people with mental or behavioral health disorders, but we've also seen increases in almost every category for disability payments in general. Moving on to our next publication, which was our Prevention Watch. This came out in October. Again, this is a regular publication that comes out roughly every 2 months. It looks at any developments towards preventing poor health in Scotland. And for this publication, we lean really heavily on Public Health Scotland's definition of prevention. So PHS outlines 3 levels of prevention, with primary being an action that addresses problems before they happen. Secondary prevention focusing on early detection, and tertiary prevention, attempting to minimize the harm of the problem. But because SHERU really focused on the socioeconomic determinants of poor health, we're specifically interested in any preventative actions at the primary level. So anything that improves the condition that people in Scotland live in. So across our first publication, we looked at 4 topics. Comments from the Auditor General on the importance of leadership in prevention, parliamentary scrutiny on prevention around homelessness and suicide legislation, comments on poverty and health, and sort of outlining what we mean by prevention moving forward. And our next publication is due out tomorrow. So again, please take a look at our website and our socials for details on that publication. But the main goal here with this report is to highlight and publicize any work that's being done on primary preventions. So if you're doing any work in this space and you'd like to disseminate that further, this is one avenue for that. So please feel free to reach out if you've got any developments, if you've got anything working, if there's anything that you think, you would love, I guess, a bit free publicity, please reach out to me. And do note that Allison is spelled American with 2 L's. So that is one thing that comes up a lot. But again, we'd really love to help make sure that any work in the preventative space is being acknowledged and being brought to light. And our third report, the final report that I want to discuss, was comparing the results of the 2022 census to the 2011 census. So we looked at the differences in outcomes for health and a variety of socioeconomic determinants of health for deprived and non-deprived areas in these 2 years. So these include things like self-reported health and disability, immigration, ethnicity, work, unpaid care, qualifications, and housing. So to do this, we used the nearest index of multiple deprivation to each census, which means that there are slightly different geographies between these 2 years. But we felt that it gave us the best picture of what was going on in deprived areas. If you lived in a deprived area, what does that look like in 2011? And if you live in a deprived area, what does that look like in 2022? Even though these areas may not necessarily be one-to-one, they may not be the exact same. And our findings were generally consistent with what we know about the stagnation and general deterioration of Scotland's population health over the past decade. People in 2022 are more likely to report bad health than in 2011, more likely to report a health condition or disability, more likely to be out of work due to ill health or disability, and more likely to provide unpaid care. In both 2011 and 2022, we found that people in deprived areas were more likely than people in non-deprived areas to report all of these, outcomes, meaning that the gap between these 2 areas has widened. So while these issues are affecting everyone in Scotland more than they were previously, they're disproportionately affecting people who are living in deprived areas. And looking at some of the socioeconomic and intersectional determinants of ill health, we saw a lot of growth in the minority, ethnic, and migrant population between these 2 years. Historically in Scotland, we kind of thought that people from minority backgrounds were in better health, as are recent migrants. But what this really highlights for us is that as these populations grow, we really don't have a lot of data on them. This absence in data, these gaps in data, becomes increasingly problematic the larger these populations get. People in Scotland, in some positive news, people in Scotland are more likely to have degree-level qualifications, but that likelihood has not been proportionate. So one thing we found was that degrees are more concentrated in non-deprived areas and have gotten more concentrated over time, meaning that while everyone in Scotland is more likely to have gone to university, the gap, again, is widening between these deprived and non-deprived areas. With homeownership levels, we found little changes. One thing that was notable was that people are more likely to live in private rentals, which is something worth noting, given that these rentals tend to be lower quality and more expensive than social rentals. Finally, so we are looking to produce another work on the census in the coming months. As they release reports that cover multiple variables at lower geographies. This allows us to do this kind of analysis where we're looking at data zone level, we're looking at, deprivation and other indicators. So ideally, we'll be able to see how various determinants of health interact with each other and with deprivation, instead of looking at each one in isolation. So this sort of allows us to get a better picture, better understanding of how these sort of complex, issues have changed over time. So again, if you have any questions for me, please feel free to put them in the comments. Please feel free to check out our website to see these publications if you're keen on learning more. But with that, I'm going to go ahead and pass it on to my colleague, Fiona.
Okay, so I'm working on the strand around strengthening policy implementation, which is one of our most interested strands at the SHERU unit. What we're interested in is that implementation space. So really delving in between that gap between policy intent and lived realities. And within that, we've got a couple of different strands that we're looking to bring together and bring that cumulative and intersectional understanding of what's going on. One of the things we'll be doing is top-down policy tracing. So this will focus specifically on analysing the implementation of 2 specific policies to help us understand and improve social determinants of health. We'll also be doing some bottom-up research, working with community researchers, looking at our populations of interest, young to middle-aged men and parents of children living in poverty. And we'll also have a kind of middle strand where we'll be delivering a programme of action learning sets. And this again will help us understand some of these questions around policy design, policy implementation, how our policy is operationalised, what's the actual end user's experiences in terms of what the community experience at the end results. So we're looking to kind of understand some of that strategic space, but also that operational space in the areas we're focusing in. And for us, the 2 strategies that we are really interested in just now is the Housing to 2040 strategy and the No One Left Behind strategy. So we want to kind of really think about the socio-economic determinants of health and what that's telling us. And what we'll be doing through that is looking at these national targets, what these national ambitions are, what does that tell us, what might that mean overall for health inequalities in terms of the general picture, where might they reduce, where might they not reduce, but also thinking about where is the potential in some of these actions and what does that mean, what does that tell us. Now, from some of the earlier analysis we've done in terms of those big quantified targets within the strategy, so we've got a number of those such as the affordable homes target, investing in community-led regeneration, money for the £50 million vacant and derelict land investment programme and many others. So what we were doing is kind of looking at the implementation of these and how these are playing out on the ground. And I guess as a strategy also, when we look at the Housing 2040 strategy, it's been a very interesting strategy to explore. This strategy looks at a lot of kind of complex and different actors within it. You know, there's a lot of different players in the housing field, and understanding what that means for inequalities is really important. This is a strategy began pre-COVID and was written as a post-COVID response. But again, we know there's been a lot of changes, particularly in the housing sector since then, particularly when we talk about 13 local authorities that have now declared a housing emergency within Scotland. So this has been a very kind of changing political space, a very kind of hot political space. Obviously, as an overarching strategy, it interacts with many other kind of policy arenas, and again that implementation space in terms of those interactions with other strategies and our policies, and again what are the consequences and unintended consequences of that is of real interest to us at SHERU in terms of thinking about what does this mean for health inequalities and what does this tell us about health inequalities. One of the things that has come through analysis is there is a bit of a lack of intersectional understanding within the strategy, and there's a limited sense within the strategy of the cumulative impacts of health inequalities and key groupings that we are interested in. And again, lots of kind of challenges in terms of that political space, in terms of investment, for example, in terms of the housing budget, and then the recent reintroduction and so on. So this has been a very moving space in terms of how the strategy is working and operating and delivering. Now, as a unit, we're obviously interested in what the national policy context tells us and what that national approach looks like, but we're also interested in understanding that from the end user's point of view, and this is where our community-based research comes in. We have commissioned Scottish Community Development Centre and the Poverty Alliance to be doing work on this area, and they're going to be working with us, recognising our evidence base that we already know has come from that report, No One Left Behind, that Kat mentioned earlier. Now, what we were doing is having clustered populations, families with living in a low income with children, and also young men aged 18 to 44. And we'll be supporting them to take a solutions focus to the community research. So thinking about that local implementation space, thinking about that local delivery space, what does it tell us? What's working, what's not working, and what does that look like through the lens and experiences and the lived and living realities of these different populations? And I think what we're offering in terms of the intersection between this strand and the other strands that we discussed earlier, the action learning sets and also the policy tracing work, I think it offers an approach where we're really thinking about knowledge hierarchies and how we understand some of these national strategies and how we make sense of some of that implementation space. So we really want to bring that nuance and diversity within the work we're doing. And really, we also want to make sure that we are amplifying and understanding the voices and the knowledge of those experiences at the sharpest end. And again, one of the kind of benefits of the model that we're taking within this work is that opportunity to explore some of those complexities within lived and living realities. You know, some of the kind of challenges people may face in terms of their daily decision making and what that means when they're stuck between multiple complex and intersection policies and systems. How does that actually play out for the people on the ground? And again, I think really critical for us here is to just bring curiosity to the fore in terms of what's going on for people and really understanding and having an open mind to what might come through this work. The middle strand of our work is our programme of action learning sets. So this is looking to explore again our targeted interests of housing and employability, but also our populations of interest. And what action learning sets do is they are a targeted kind of change methodology. So we'll bring through this process, which has been facilitated by Community Renewal Trust, practitioners and stakeholders from different places to capture and explore strategic and operational insights. This is going to be a really kind of unique strand. We'll be having all that intelligence, that learning in terms of the real-time context and what considerations and operational and strategic constraints practitioners and stakeholders are facing locally. But we'll also have an opportunity to think and consider and try and challenge some of those often policy silos and really bring some of that peer-to-peer relationships and that relational work that we know is so often most effective when we're looking at how we make change and bring about challenge. And again, the unique opportunity in terms of this particular strand of work is that we really can build and tailor this piece of work to think about local evidence and knowledge. So certainly from some of the local authorities we've been talking to around what's going on for them in terms of local strands, what are the local kind of challenges they're facing, and how can the action learning sets kind of support and enhance. And that's a really kind of critical thing for us at SHERU is, you know, we do not want kind of duplication of work. We really want to be thinking about where we can add value and where we can add new and important insights. And again, one of the critical things about this particular strand and the other strands is the interconnection between them. We are really interested in not just seeing these as separate work streams, but as integrated work streams. So how can we take some of the learning from the policy analysis into the action learning sets and also community research, but also in reverse, how can we take that evidence up from the community research into the policy tracing and also the action learning sets. So there's very much a methodological approach that is fluid and has flex and agility to be able to really think about what are quite challenging local contexts in terms of certainly the need from people on the ground, but also the kind of practice and operational context that people are working in within local authorities in Scotland. It's really important to us to have a methodology that can kind of travel along with that and bring us insights that are relevant and timely through this work. And I guess what we're trying to do is offer a kind of different new model of thinking about this in Scotland. We've had quite a level of interest within this work, and we're currently in talks with multiple local authorities across Scotland, and we'll be making decision-based making on this at the end of the month. And again, we're not taking a specifically place-based approach, but using place to situate and understand kind of local implementation experiences and perspectives. So a kind of unique and different model within what we're trying to do. And I'll stop sharing and pass you to my colleague, David.
Thanks, Fiona. I'll just share my screen. Feeling the pressure since all my colleagues have stuck to time almost to the second, so I'll see how I get on. Okay, so hopefully everyone can see that. So yeah, so my role, as I said earlier, is on leading and enhancing the evidence-based work strand, and I thought I would start quickly with this slide. Some of you maybe have seen it before, maybe heard me talk about it before, but it's just a quick way of illustrating the sweet spot in terms of the focus of the unit, and also the intention around integrating the evidence types, so integrating qualitative and quantitative data and evidence. I've tried to summarise the three main areas that this work strand will cover. So improving accessibility and visibility. And I'll talk a lot about this today because that covers a lot of our early outputs. So things like reactive stats briefings, a replication file that I'm going to talk about, and also data at a glance. Resource which I've been working on just before Christmas that we've got up on our website just in the last week. Enriching the data landscape. So a lot of this is work which is still to come, but just to give you a bit of an understanding of what we plan to do here, looking to work directly with data controllers around continuous improvement. So that might be around data collection practices, it might be around greater standardization of definitions. We want to look a bit closer at barriers to data collection, to think about analysis of response rates to sample surveys, and also think about innovative alternatives to surveys, perhaps things like personal data stores. And also within enriching the data landscape, we want to have an attempt to broaden the focus beyond SIMD, so beyond Scottish Index of Multiple Deprivation, to capture a kind of wider range of factors and insights within our analysis. The third area, which called reaching the feasibility frontier, which really means how do we get more out of existing data. We want to kind of do a kind of deeper dive into administrative data in particular to make data linkage recommendations and also identify opportunities to maximise the insights gained from longitudinal data sets. And I'll say a bit about some of the work that we've got underway on section 3 near the end of the presentation. So just very quickly, so what I'm going to cover is the establishment of our reactive stats briefings. I'm going to say a bit about a replication file which is now available and that sits alongside our launch report from September. Also from our September report, we've got this data at a glance resource as well, and I'll say a bit about that. And then I'll say a bit about something that's coming next, our areas of research priority. So just jumping straight in, reactive stats briefings. So what are they? So one of the aims of the unit is to produce reactive statistical research briefings that summarise relevant data releases. Anyone who follows the work of the Fraser of Allender may have seen some of the roundups that I produced for a different project concerning the lives of people with learning disabilities. So I do kind of frequent roundups on the data news, the latest research and stats, and these have proved quite popular. So the idea is similar here. And as I've said here, you know, these are to be concise, short briefings, short outputs, and we want to demystify complex statistics and methodologies, also talk about some of the data limitations as well. And, you know, sometimes the data and statistics may not even be complex, but finding that data can be quite difficult. Can be difficult to go through large publications, large documents, large sets of tables, and it can be time consuming as well. So, I mean, we're doing this all the time, so it seems like a very sensible offer from the unit. And I suppose the USP would really be bringing together the quantitative and qualitative information in one place in a concise format. I think it just provides a bit more depth. As I said right at the start when I was doing my introduction, I was a statistician within Scottish Government for many years, and you know, those statistical publications that I used to produce, I know that they don't provide that that kind of integration of evidence in a way that we can offer. So yeah, I think it is a USP that we've had some good feedback on so far. So we've done 5 of these already, and I would just, you know, encourage people, if they've not seen them, to check out our website, check out our social media, because we'll usually do some sort of thread once we kind of publish one of these, which are usually very closely on the back of the statistics themselves being released by the statistical provider. So we've done one on primary one body mass index statistics 23-24, which was a Public Health Scotland publication. We've done one on life expectancy in Scotland, that was NRS. We've done one on homelessness in Scotland statistics. We've done one on alcohol specific death statistics, and our very first one was on the 2024 SQA attainment statistics. Now, if people have requests or ideas for us to focus on, you know, a particular topic or area that they think would benefit from one of these reactive stats briefing outputs, or just for, you know, it might be something that would benefit their particular organisation, especially if you need something explained in quite a short and concise manner, please do let us know. We can't cover everything. There's a lot of data released relevant to the work of the unit, so it does help us plan and prioritise going forward. So just to give you an example of one of these and kind of give you a sense of what it's about, you know, you'll find all of these under the publication section of our website, and this is just a screenshot of our website. They're all designed up in a PDF, like you see on the image on the right hand side, but there's also HTML versions available as well. So homelessness in Scotland statistics. I've just taken snippets from the reactive stats brief to give you an idea of what one of these would typically look like. So, you know, at the start here, I've got some, you know, explanation, whether that's, you know, definitions or processes. You'll find that in most of these briefs. Go on and have some commentary on the headline stats, on the kind of quantitative data, and we'll reference any related publications as well. You'll always find some sort of chart or visual within these. You'll probably find at least one, if not more. And then you've got the call site here, which provides that depth, which I talked about earlier. And more often than not, there'll be some sort of policy reflection, some sort of policy comment. There might be some concise coverage of our populations of interest. Talked about earlier, families with young children, mid-aged men, and then they'll have some sort of kind of short concluding statement paragraph. So for example, with this one, you know, we really wanted to reinforce that, of course, addressing homelessness is about providing shelter, but it's much more than that. It's about tackling the root causes that lead to housing instability, which in turn drive health inequality in Scotland. So if I just move on to talk about something else, which is this replication file, which is essentially a downloadable zip file. And again, this is where you'll find it on our website. So if you have a look at our reports, look at the report that we put out when we launched the unit, the 2024 Inequality Landscape. And we're not covering that today because we covered that at a kind of previous in-person event. But that is got a lot of information in there. There's a lot of data, and of course you can download the data tables themselves, which I'm push pointing to here. But we've also made this replication file available. So if you download the tables, what you'll notice is that where the sources are given, a lot of the sources point you to other publications, other reports. We've been able to kind of take that data directly. But there are a number of tables which the source will state the UK Data Service, because we've undertaken analysis of microdata, which is made available by the UK Data Service. And that tends to be related to households below average income, annual population survey, and also the Scottish Health Survey data sets. So we wanted to kind of make sure that people are able to replicate our analysis and be open and transparent about it. And we'll plan to kind of think about doing this for kind of other releases going forward where appropriate. It's very much a starting point. You know, we might look at opportunities to scale this. At the moment, you know, it's not a GitHub effort. You know, we may want to collaborate on code going forward, but as I said, it's something that we're just kind of starting with. Doing it this particular way, we'll get some feedback and we'll build on it going forward. So if you go into that replication file and you download it, you'll essentially open up a folder like this. And what I would encourage people to do is read the README, seems obvious, but that'll tell you more about how to acquire the data from the UK Data Service, how to download it, how to define global variables, and then running the scripts and troubleshooting and citation and your responsibilities and all of that good stuff. And this is just a little snippet from the README itself, which tells you a bit more about these folders. So one of the folders is this one called do, which is short for do files. So the analysis that we undertook was done using Stata, and that's what the scripts are provided in. If you follow the instructions, you should only need to run one of these, which is this run.do, and it will run all the other do files automatically. Now, I appreciate not everyone has Stata or uses Stata, but there are a growing range of online resources available for code conversion. So hopefully you'd be able to utilise one of those. And if you open one of those do files, if you don't have Stata, you're still able to look at it as a text file. So again, you have the code there. As I said, you could use the kind of code conversion resources to be able to kind of run that in R, for instance. I know, for instance, there's an R package that will do that conversion. So again, a bit, a bit like the kind of reactive stats briefings as well. We're looking for feedback on this. If people do kind of use it and it works well, let us know. If it doesn't work well, let us know. And as I say, we're kind of looking to kind of scale it, appropriately going forward. So if you do manage to get it all working in that run file, I say it should be pretty straightforward once you read the instructions and the README. It should result in 14 Excel output files, which will essentially be the analysis that we've undertaken using the data from the UK data service and kind of fits with what's in the report itself. And then just to kind of move on to something else, again, kind of associated with our September report, we have this new data at a glance resource, and to be able to access that, you can either find it within the publications page of our website, or go on to the HTML version of the report, the September report itself, and you'll be able to access it there. I'm just going to do a quick demo of it. I am not going to try and talk it up as a whizzy R shiny dashboard or Power BI or anything like that with lots of functionality for drill downs. It's been put together using the Canva website, Flourish charts, but we do think it's useful. I mean, there are a lot of dashboards out there. You've got the care and wellbeing dashboard, health and early years dashboard, a quality evidence finder. This is a bit different. So the difference with this is, if you download the tables for our September report, you'll get the tables kind of static as they were within that report itself. This resource is meant to be a bit more dynamic. So it has the same charts available to you, but we're trying to update that data over time. So whatever you saw in our September report, this should provide you with the same charts and the same ability to download the most up-to-date data. So it's very simple. It kind of mimics the topic areas in our September report. So you can just click in one of those, and you can go in here. You'll always find the definitions and any information that's needed to kind of help you understand what the charts are telling you. And then you can just scroll through the charts using these buttons at the top. I mean, it still has some level of interactivity on it, so you can isolate particular trends. If you want to get back, you just click on the definitions, and then the arrow will take you back to the kind of options page as well. And as I said, you're able to download the data as well. So you can download it here. And as I said, that will give you the data relating to the most up-to-date tables and charts, which this resource is essentially aiming to supply. So yeah, again, something that we could scale, something that we could build on. So feedback, ideas for further refinement and improvement are all very, very welcome. And I'm just going to try and come out of this to get back onto my last slide. Yeah, so my last slide, and this is something which is coming soon. So it's kind of headed areas of research priority, but we have plans to develop something similar, akin to the areas of research interest outputs that are commonly produced by UK government departments. So if you look online, you'll see the HMRC, HM Treasury, DFE, DWP, Cabinet Office, Ministry of Justice, they all have areas of research interest outputs. Obviously, we're not a government department, so we'll probably do something which is slightly different, has a different shape and form to it, and we'll call it something different. So likely we'll call it areas of research priority, and just to kind of make that distinction. But I mean, in terms of the point of this, it's all about, as I say in the slide here, it's all about strengthening collaboration. It's to help researchers and also to help organisations such as ADR Scotland, so Administrative Data Research Scotland, Research Data Scotland, and even the Office of National Statistics, who are responsible for making linkage and research-ready data sets available within appropriate research environments for people to undertake, analysis and different projects. Areas of research interest they give details about the main research questions that face government departments. They're a way for government organisations to indicate that they're keen to hear research evidence or insight related to that particular area. And of course, we have our plans to do our own research and do our own proactive analysis, but we're not going to do everything that we're able, that we're interested in, and we're interested in lots of stuff. We come up with new ideas almost every day. So we feel this is a really good way to collaborate with others and also act as a bit of an enabler to support some relevant work being done in this area that perhaps might not be done otherwise, or might not be done at the same pace. This might enable to be done quicker, or to collaborate, or for people to understand what others are interested in, etc. So we're working on a kind of draft just now. I say we've got loads of ideas of our own, but we'll obviously socialise this and make sure to kind of get some feedback and input, and then publish it over the next few months. And no doubt it'll be a feature of one of our future webinars. And I'll just leave it there because I suspect I've went over time. Okay.
Thanks very much, David. Great. So now we do have just under 15 minutes to take some questions. Thanks very much for your time. I know we've covered a lot of different topics. We've already got some questions that are coming in, so I'm going to kind of paraphrase the questions and think about who would be best placed to answer them. So we've got a question on the reactive stats for David. So could you, obviously there's new statistics coming out all the time. So could you say a bit more about how we choose which reactive stats, like where we're going to do a reactive stats piece or not?
Yeah, so I think at the moment, obviously we had the reports that you highlighted at the start, Kat, which then kind of led to our September report, where we kind of focused on those kind of 5 areas in terms of socio-economic determinants of health, and those have kind of been the kind of areas that we've kind of aligned our thinking to since that point, really. A big part of what we look at in terms of knowing what's coming up is the Scottish Government's forthcoming statistical publications resource spreadsheet, which is updated every week, and we're well connected to Scottish Government, well connected Public Health Scotland, so we're speaking to those teams on a regular basis, so we're getting an idea of what's coming up and what's relevant, and we're kind of making their kind of judgment based on that. But as I said earlier, be really good to kind of hear from others in terms of other things that or maybe other areas that we've perhaps not thought about, or even people want to check what's on our radar. There's a lot of publications coming out, particularly some kind of Tuesdays in particular. You get a whole, I think Social Security Scotland, for instance, they tend to put out a lot of information on different benefits on the same day. So yeah, it's just try to kind of make sure that we're being proportionate in terms of what we can cover, and make sure we're not kind of repeating things that we've kind of said before as well. So yeah, that's a kind of general approach, but we're happy for it to be informed by kind of user demand and kind of feedback as well.
Great. So yeah, if you've got thoughts on that, please do let us know. And then we've got a couple of bigger picture questions, which I'm going to put to Emma. So there's some comments. They're expressing frustration at the lack of accountability when it comes to implementation failures in Scotland. So a question about whether SHERU's work will help address these kind of accountability for implementation failures.
Thanks, Kat. Thanks for the question. Nice to see you, Lynn. So yes, one of our key responsibilities, I suppose, given our how we're being funded, is to have an independent view of what's happening in Scotland, and to do scrutiny that brings to the fore some of the key issues that we think need to be talked about. There's a lot of people working in this space in Scotland, but actually a lot of people are either within the public sector or rely on funding from public sector to do their work, and therefore they're not always as free as they might like to be to say what they want to say publicly. So that's one of our roles that we have, is to use our voice to scrutinise what's happening. And the lack of implementation, it's something that's talked about a lot, and that most, if not everyone, agrees we are not consistently doing well on. although there are exceptions to that, obviously. So what we are really trying to look at, and this is through the work that Fiona's talked about, but also through things like the September report that we published, which looked quite closely at progress on key indicators that link to policy outcomes, and showed where we do not have evidence to show progress being made in the way that it was expected to. So yes, it is within what we're looking at, and really trying to shine a light on that implementation part, particularly where it links to what Alison was talking about in prevention. Watch that primary prevention place. So we will be quite heavy on the scrutiny. But there is, there's a lot of work that needs to be done. It's not something we can do by ourselves. There's that kind of transparency in the way policy is put together, and options appraisals and things like that. Transparency in terms of how Scottish Government budgets are put together, and where money is getting spent, are all things that are within kind of the Fraser Vallance's remit as well to look at. So we'll be using those synergies as well to try and bring fresh eyes and a bit more scrutiny to these areas.
Thanks, Emma. And then a follow-up question for Fiona, which is about the types of insights that we're going to get from the implementation work you described. So there's obviously lots of different strands to it. So when you bring it all together, what are we hoping will be the insights that'll help us understand and make a difference in that implementation landscape?
Yeah, so across the different strands, we'll have quite diverse insights. We'll have that perspective from different communities on the ground. We'll have those different practitioner and unusual suspects that we're looking to bring through the action learning sets. So thinking about maybe some of the private sector and so on, and what does that what viewpoints and challenges and so on we're facing there, as well as that kind of national and local policy tracing and what that tells us in terms of different local contextual challenges, different local needs, the balance and trade-offs and policy consequences and unintended consequences that are often faced in that national and local policy tension. So cumulatively across them all, what we will have is quite a unique picture and story to tell around what does this mean for tackling this, looking at housing, what does this mean for employability, what does this tell us overall about the socio-economic determinants of health, and how is this actually helping us reduce or not reduce health inequalities in Scotland. So it's the accumulation between all of the different forms of evidence and not making sure that we've got those different voices and perspectives and insights. Again, picking up on Emma's question around accountability, making sure that we've got bringing together those different forms of evidence and where there might be conflict points and consensus points on understandings of what's happened and what's not happened as well.
And then there's a question which I'm going to put to Alison, but Fiona might want to chip in on as well. That basically some different population groups have been flagged. So people who access disability benefits, unpaid carers, and low-income women, all flagged as population groups. So the question is basically, what work is SHERU doing to explore those specific population groups?
Yeah, so we've got some work coming out alongside the census analysis. I think one of the things we're really hoping for with the next round of multivariate publications is that we'll be able to isolate health outcomes and socioeconomic outcomes for women, for single parents, for people from different ethnicity and disability backgrounds. A lot of our work is going to be focused on young men because they are at risk of a lot of, really extreme health inequalities. But that's not to say that we're going to, not be paying attention to women. We're not going to be paying attention to how different socioeconomic circumstances affect different groups of people. So I would say, for both of those groups, that's going to be kind of a thread throughout, even if they're not going to be our priority population groups. They're people that we are going to be paying attention to. Fiona, if you have anything else to add to that?
Particularly around in terms of some of the action learning sets. So we're very much trying to understand and kind of operationalise what does that mean in practice. This has certainly been an area of interest through lots of the kind of early discussions we've had particularly in relation to, you know, deaths of despair and what's that kind of telling us, and what, you know, how are we addressing that. So as a population, you know, young men aged 18 to 44, that's a diverse population. You know, there might be men in employment, men that are economically inactive and so on. And again, we want to try and understand as much as possible the different kind of nuances within that and what that tells us, and what we can illuminate there as well.
And the final question I think that we've got time for is a bigger picture one again. So I'm going to go back to Emma. So some kind of comments and concerns around public sector cuts. So a question about whether SHERU is working to analyse where those public sector cuts are falling and what the likely impact is going to be on health inequalities.
Yeah, absolutely. I think this is a really interesting area because there are trade-offs in budget making, and we're likely to see continued kind of, however you want to describe it, moving around of budgets or in-year cuts, all kinds of things that need to move throughout the year in order, particularly in Scotland, to balance the budget. So inevitably we do see areas where funding gets reduced. It's not always an increasing thing, and because we have had a decade and a half of quite a difficult public spending environment, there's a lot of those cumulative factors that have built up over the years from those reductions in spending there. So we really want to get a good grasp of some of the specifics there. I think that's where we want to focus on. There's a lot out there already about sort of the bigger picture, but in terms of what is the most harmful form of cuts, you know, how do you minimize the impact of difficult decisions on budgets on health inequalities. So as well as areas where there are spending cuts, there are areas where we're seeing spending increases, for example, in social security. So understanding all the evidence around that and how that will impact on health inequalities. And, you know, we'd really want to be able to answer those questions about, you know, where is it better to focus money? Is it, say, on housing, warm housing, as opposed to, say, more money going into social security? There's the questions that we don't really have the answers to in terms of health inequalities. So it can't just be a spend more good, spend less bad. We need to get more into those specifics, I think, and that's where we will be trying to focus over the next couple of years and start to chip away at that a bit more. So we've got a bit more of kind of really sort of more answers that are more useful, I suppose, for policymakers in terms of they can inform specific decisions in what is a very difficult fiscal environment.
Great. Thanks, Emma. Thanks, everyone. That's bringing us to our close, really. So really appreciate your time. Thanks for coming along to the webinar. If you'd like to find out more about SHERU, the easiest way is to visit our website. So if you just Google SHERU and Strathclyde, you'll easily find the website. And then on the website, you can sign up to our mailing list if you want to get the regular updates as we publish issues. But yeah, really appreciate your time and hope that was useful for getting a sense of what we're planning over the next few months.